My name is Martin Metz. I'm a dermatologist from Berlin, Germany, where I am the Deputy Director of the Institute of Allergology. So what I am talking about at this year's AAD conference here in Denver is on the topic of what's new in urticaria. And I'm not doing this alone. We have a session with 4 people together with Brian Kim, Ana Jimenez, and Jason Hawks. And we will be giving an overview of what's new. And there is a lot new because we have a new guideline. And this is what I focus about in my presentation. So explaining what it means to have a new guideline, a new international guideline, which is really big. We have more than 200 participants within this guideline from more than 50 countries. So this is really a huge guideline effort, and I am explaining a little bit how these guidelines are made on evidence build, and then go into detail on what's indeed new on the diagnosis and the management. There is need for a better management of our patients with chronic spontaneous urticaria. And then maybe the most important bit of this new guidelines, and what's new for basically everyone in the world, is that we have a new treatment algorithm. So a new recommendation on the drugs that we should be using in the treatment of patients with chronic spontaneous urticaria. And this is, and it was before antihistamines, this is the first line, but what's really new is the second line, if antihistamines fail. And we now have in the recommendation 3 different drugs, and that is omalizumab, as we had before, but in addition to that, we now also have remibrutinib, BTK inhibitor, and dupilumab, which we all know. This is not approved in all countries in the world, but it is the recommendation of the guidelines based on the evidence, based on the phase 3 data. So I had the honor to present 4 posters here at the AAD, and all of them are around urticaria, which in itself is already something very special because in the past, the AAD was not the place where there was a lot talk about urticaria. So this shows already the increased interest in this disease, also in the US, but also worldwide. So 2 of the posters that I presented is around barzolvolimab. This is a new drug targeting KIT. By blocking KIT, we inhibit the binding of SCF to mast cells, and by doing so, the mast cells go into apoptosis because they starve. And we have published data on chronic spontaneous urticaria, phase 2 data already before, showing the efficacy of this treatment with barzolvolimab. And what we present here at the AAD is now the rate of patients that achieve improvement in the quality of life through the treatment with this mast cell depleting drug. And this is the phase 2 long-term extension data, and what we see is that we have a large proportion of patients that is achieving a DLQ 0 or 1, so basically no impact on the quality of life during the treatment. But maybe the most important aspect to it is that when we stop treatment after half year of treatment and then follow these patients up for another half year, we see that the majority of these patients stay controlled, stay on a DLQ 0 or 1, and only a small proportion of the patients do come back getting a DLQI of 10 or above. The other poster on barzolvolimab is showing also DLQI improvement, so the quality of life improvement, but now not in patients with chronic spontaneous urticaria, but in patients with chronic inducible urticaria, which is a group of patients that have been neglected a lot in the past. So I do think that this is very important that we now show data also on these patients and on the effects that we can have with a good treatment in these patients. The 2 other posters are one, remibrutinib, so the BTK inhibitor in chronic spontaneous urticaria. But this is more like a poster on what we will do in the future. So here we present the REASSERT study, which will be a global study performed really in large number of countries worldwide, looking at patients that do receive remibrutinib as part of their normal treatment and look at certain aspects on how they do during the remibrutinib povorcitinib treatment and how this compares to patients treated with antihistamines and with omalizumab. And finally, another study with povorcitinib where we look at, so this is a JAK inhibitor also in the treatment of chronic spontaneous urticaria, and here we look at subpopulation of patients that have low IgE, because those have been in the past our difficult to treat patients. Those are the patients that do not respond adequately to anti-IgE treatment, omalizumab. And what we do show with this povorcitinib treatment is that this also works especially well in the patients with very low total IgE.